Hello, welcome back to another video with the Practice Nurse Mentor. I'm Alicia. Thank you for joining me. So this video, I thought that I would go through how to do the reviews of your GP chronic condition management plans. So since the 1st of July, when they first commenced the new framework, we're now in October. So that means that we should be starting to bring people in for their reviews now that it's been 3 months. So I thought I'd just do a very quick video to show you some guidelines as to how you might want to do those and how easy it is to update the original plan as that living document. So let's get started. I've got the sample program of best practice running here. So let me just bring up my page with my patient. So this is not a real patient. All of the information that you can see here is part of the best practice samples patient cohort, for want of a better word, sorry. So yes, none of this is real. The patient that I've chosen today has already had a care plan done. I think I used him in a previous video not long ago. So he's definitely got a care plan happening. So this fellow has got type 2 diabetes, hypertension, osteoporosis, just as a couple of chronic conditions that we have his plan running for. So when we're looking at the types of things that we can do when we do a review, I'm not sure how this works at your practice, but most of the time the patient will see the nurse first and then they see the GP afterwards. So if you're the nurse seeing the patient, you can start collecting some of the information ready for the GP to finish the review. So what I like to go through first is basically just check and make sure when the date of the plan was or when their previous review was, so that you know that you are in the appropriate time frame for doing a review, so that every 90 days, every 3 months. So I will just pretty much make a note of it here. Now, obviously then we're going to basically do our OBS that we normally would do depending on what is in their plan. If they're doing osteoporosis, are we due to do a height measurement for them? I like to do at least one a year with them, unless they specifically need twice a year. So depending on the patient and the chronic conditions that they have, the types of OBS that you're performing might be slightly different. So that's why I've written it here as specified in the plan. And you can be really, really specific about that in the plan, and that the nurse performs those duties and they can attract the 10997 down at future appointments if that's what they're seeing you for. Once I've done that, I will also check and make sure that there's been no new diagnoses or new changes to their treatment since the last time the plan was updated or implemented. And sometimes this happens. So they may have only recently been diagnosed with osteoporosis or recently diagnosed with acute kidney injury or something like that. So, or peripheral neuropathy or diabetic retinopathy. So you can update that in the plan, and obviously any management for that new diagnosis can also be included in the plan. Likewise, if there have been any medication changes or they've been commenced on something that you now need to do some monitoring for, do they need to be having annual ECGs now? Those kinds of things can all be added into the plan. I'll also make a note of any appointments perhaps that they've attended over the last few months since you've seen them last for their plan. And so if they've been attended their cardiologist, have they gone to the endocrinologist, anybody like that, and then make a note of anything basically that was covered during that. So you may discuss that with the patient. So what did the specialist say? You might have some correspondence that you can refer back to and just discuss that with the patient, and amend any information that you need to do so in the plan. I'll also check and see if there's any outstanding or anything up to that is due to be done in terms of investigations, screening, so mammograms, bowel screening, cervical screening, those sorts of things, and as well as any immunisations that may be due now that you're seeing them again, and just check on where they're up to with those. Do you need to do anything for them today in terms of immunisations? But if they are due to have an investigation done or a screening done, then you may want to pass that on to the GP. Were they given any allied health referrals last time, and where are they up to with those? Have they attended them? How are they going with them? What are the outcomes so far? What's the feedback you've got there? And you can document that in the plan as well. You can also review their goals now that if they are attending those allied health visits, have their goals changed now? And if so, then you can again add them into the plan. Have they achieved certain things? And if they haven't yet, what are some barriers that's maybe help to preventing them from reaching those goals? And is there something that you can support them with or make suggestions for with regards to passing that on to the GP? So next you can go in and actually amend that plan. So if you've already done it here in the side here of this enhanced primary care section, then it's simply a question of going in and adding. It'll ask you if you want to continue, because this one is within the time frame. It's asking me if I want to continue working on it, but normally, once it's past that 3 months, it'll ask you if you would like to review it, and then you just hit the yes button. So sorry, it's not the best example for this particular patient. So here we could add in the extra thing that perhaps they've been just recently diagnosed with that type 2 diabetes now, so you would add that into the plan. This section up the top here is where you can write some of the information that you have started to free text over in your other notes. And you can simply copy and paste that over into here. So you can say attended cardiology review, and then you can just write in the date that happened, and write something simple comment about what that might have been. So stable, review again in 12 months, something along those lines. You can also, I've got a little fly buzzing around me, attended 2 sessions with physiotherapist, and then you can write whatever feedback the patient has given you about those, getting some satisfactory relief or has improved range of motion, whatever some of those goals, you can relate it back to what their original intention was for being referred to those allied health providers in the first place. So yeah, up the top there, you can just continue to be writing in some of those notes. And as I said, if you've already been typing it up over in that other section in your free notes, then you can be cutting and pasting over here just to make it a little bit quicker for yourself. Down the bottom here is where I might cut and paste some of the OBS that I have done that day and any other comments. So put the OBS in here, but then you might also want to put in due for BMD in 2 months. Or something like that, there's some extra comments that you can put into that might be something that they're going to work towards between now and the next review. Okay, so once you've done that, then you basically hit save. Now, I'm going to say no for this because I'm going to want to be able to come back to it another time down the track and review it again. But that's simply that's all it is. And then normally you will have another entry dated here with the review date. It's not done that here because it was too soon. But then you would just have the review dates as it continues down the page. Now, if you use the other care plan document that's in best practice, and I think it's the GP. I don't know that it's in this one. Sorry, but it essentially it's the same thing. If you're using the Word document format, you would simply just go in and edit the same way that I just showed you, the same way you did the document in the first place. You would simply go in and edit, add all of the extra information in and save it, and then it will save with the new date as a review. So either way, it's going to do the same thing. Okay. So once you've gone in and updated and amended the care plan, you can now sit with the patient and work out when the next review is going to be. You can either book that in directly now, or you can put a reminder up in the system to make sure that they're coming back in 3 months' time. And then you can also have some comments now as your handover to the GP. So here you could write, will be due for BMD in 2 months. You can also write new cardiology referral required, please. And maybe, due for blood tests. Something like that. So the doctor can read your notes now that they're going to go and see them next. So you've got a little documented handover that you're passing on to the GP about some things that you have uncovered throughout your conversation with the patient during the review. So in a nutshell, that is it. Then you can also add those, but you can go here and you would write, oh, I'm in the wrong spot. Reason for visit. GP management plan review and save. So now you've done the review and that's it. So it's really not too difficult. There's no need to reinvent the wheel and create new documents from scratch just specifically for the review process. You just simply keep amending the original document. It's a living document, so it's just going to be a continuation of the plan every time that you review it. So I hope that you found this helpful. Thank you so much for joining me once again. If you've liked the video, please indicate that you did. And if you're not already a subscriber, please consider doing so that you can keep up with more content as I produce it in the future. Thanks a lot. Bye for now.